you for joining us this morning. Welcome to the Colorado Conversations 2022 Elections Town Hall. This morning's forum is brought to you by Colorado Politics, the Denver Gazette, and the Colorado Springs Gazette, newspapers that value objectivity and accountability in journalism. Before voters this November is a ballot measure that seeks to allow legal access to psychedelic substances. But before we delve into this proposition, please welcome Vince Bisdek, the executive editor of the Gazette newspapers.
Thank you, Luigi, and good morning. Engagement in elections is crucial to maintaining a healthy democracy, and we hope the forum this morning offers voters the chance to learn more about what's in their ballot this November. We also invite everybody to learn more about Colorado politics, the Denver Gazette, and the Colorado Springs Gazette by visiting our websites, or better yet, by subscribing. Your support for local journalism allows us to host forums such as this. Back to you, Luigi.
Thank you, Vince. We have a great subject this morning, and joining us today is Luke Niforatos, who is from Protect Our Kids Colorado, which represents the No campaign. Luke also serves as the executive vice president at Smart Approaches to Marijuana. The Yes campaign declined the invitation to debate today. Proposition 122, under this proposal, a yes vote would require the state to establish a regulated system for accessing psychedelic mushrooms, and if approved by the regulating state agency, additional plant-based psychedelic substances. It also decriminalizes the possession and use of psychedelic mushrooms and certain plant-based psychedelic substances in Colorado law for individuals 21 and over. I do want to note that it does not allow for the for retail sales, and so it would not be the same as marijuana, which has been legalized in the state for a number of years now. So let's get right into it. Luke, tell us your position and explain to us the reasons for your organization opposing this ballot measure.
Luigi and Vince, thank you so much for having me on. I have a tremendous amount of respect for both of your talents and long track records of serving the public with providing unbiased information. So thank you both. And Vince, I am a subscriber to 2 out of the 3 papers. So hopefully that gets me a few brownie points here. But no, very much appreciate the work.
two out of 3.
Yeah, I'm not in Colorado Springs, so I don't have the Colorado Springs Gazette, but maybe I'll just throw that one in just cause. But so thank you both for having me. It is a profound disappointment and really a sign of the discourse that the pro Proposition 122 campaign wouldn't join today. I had a PBS debate last week and they also declined that as well. So I think that voters should take that into account, that if the proponents of a measure cannot even defend it in the public forum, what does that say about their ideas? And so we should consider that. But as far as my concerns about Proposition 122, so let me just back up for a real quick second. So, you mentioned that, it doesn't legalize retail sales of these drugs, and that's true in terms of by the textbook definition. However, what this measure does, Proposition 122, it legalizes the advertising, promotion, distribution, and use and home growing of magic mushroom, psilocybin, psilocin, ibogaine, a couple of other psychedelic substances by the year 2026. So what that means is what you're going to have is a gifting economy, much like what Washington, D.C. has for marijuana right now, where you will buy a $500 pair of socks at a not pot shop, and you'll get that $500 pair of socks and you'll get a bag of weed as well. That's how they get around. It's by design, and if you look at the way this measure is written, it's very much similar to how DC wrote their marijuana rules. So really important we understand that this is, while it's not explicitly retail sales, what this measure does is it creates a retail market where an industry will produce these products. They will sell these products in terms of they will give them to facilitators. That's not going to be free. Facilitators will then be paid for their services and then provide these products to people in these what's called healing centers, which will be glorified basically psychedelic shops where people can go and trip on these drugs. So really important we get clear about that this creates an industry. It explicitly legalizes advertising for these products. These facilitators will be paid. This will be a for-profit industry, not nonprofit. Okay, so really important we know that. The other thing we should know is that With medical marijuana, at least there was it was not scientifically validated medicine, but at least they had qualifying conditions where you had to meet certain conditions in order to get a medical marijuana card. With this medical psychedelics measure, you don't have to have any kind of conditions that you're certifying for. You could just go into any of these healing centers and receive these drugs. So that's an important distinction as well to understand about this measure. And finally, we need to understand that this is not being pushed by scientists or medical professionals. This is a measure that's being pushed by Dr. Bronner Soaps through an organization called New Approach PAC. So major corporations that have nothing to do with medicine are the ones funding this measure. We should be fully clear about that. So why does that concern me? Well, it's not already abundantly clear. This is not a measure that's following science. So the American Psychiatric Association released a statement in July of this year, so just a few months ago, that said there's no scientific evidence to support the medical use of psychedelics right now. So there is no science from our nation's top medical association that looks at psychiatric disorders, and that's what this Proposition 122 is supposedly about, is helping people with mental health disorders. The leading experts in that say there's no scientific evidence for that right now. And so from my perspective, we need to listen to the scientists when it comes to our medicine. And so that is the first concern. That leads me to the second concern I have about this proposition, which is that, you look at the way that this worked with marijuana. Let's look at the funders and who's running this campaign. So same funders, New Approach PAC, and same campaign team are behind this psychedelics measure that we're behind taking Colorado from medical marijuana to recreational marijuana. So it's the same exact players. And we shouldn't be fooled again, because clearly there's a process here to introduce drugs and kind of get people used to them from a medical perspective and then try to legalize it recreationally. It's very clear that that's what they're trying to do here. And I think we shouldn't be fooled. I don't think we need more drugs, federally illegal drugs being sold at the state level here in Colorado. I think we've got enough of a ball of wax with marijuana right now. Even the Denver Post said we have an issue with high potency marijuana and we need to figure that out. So maybe we should figure out our currently federally illegal substances that we've legalized here before legalizing more. And so I think those are my two primary concerns, but there's a lot of other, I think, concerns around that, Luigi.
Thank you for that, Luke. And to our viewers and our listeners, I would encourage you to ask questions. If you can, I would encourage you to key in your questions through the Q&A box or the chat box. And we'll try to get to as many of them as we can toward the end of the program. So let's go through some of the arguments in favor. One is that the studies have shown, according to the Yes campaign, that psychedelic mushrooms and other plant-based psychedelic substances combined with counseling may provide effective treatment, for example, for severe depression, anxiety, and post-traumatic stress disorder. And then the assumption here, of course, is that if you're going to go through the federal regulation or regulated system, it's going to take, nobody really knows when that's going to happen. Why not take advantage of what these studies purportedly offer at this point and get this done in Colorado right now?
Great point. So that is that is the one thing we are, my side, the pro Proposition 122 side. One thing we will not disagree on, we are totally in agreement that there's medical promise for these substances. And I don't need to tell you that, the FDA has said it. So the FDA said MDMA, psilocybin are breakthrough therapies. They fast-tracked these through clinical trials. So we will have federally approved prescription drug versions of some of these substances very, very soon, because the FDA has marked these as breakthrough therapies. Okay, so that process is working. And so why would we put the cart in front of the horse and shotgun state level legalization where we let entrepreneurs take the lead on our medicine? That's the part that makes no sense to me. So I agree there's medical potential here, and all the scientific community agrees. I mean, I went to Johns Hopkins. Johns Hopkins has a whole institute studying this right now. Clearly the science shows there's promise, but here's the difference between letting the FDA take medicine the way they have for the last century and letting entrepreneurs lead. Okay, so if we let entrepreneurs lead, which is what Proposition 122 wants us to do, not medicine, they want entrepreneurs and startups to do this. What we would have is these drugs being sold in their raw form, even synthetic versions of these drugs, potency could change. You know, we saw potency change when we legalized marijuana. Potency of these drugs could change. We could see a whole lot of different variables, okay? And we would have no prescriptions. We would have no dosages. We would have no idea. If you're taking 3 other medications, you would have no idea if taking psilocybin would adversely interact with those medications. We'd have no kind of scientific analysis to understand that. You wouldn't have refills. You wouldn't have a specific amount that you're taking. You would just be told you could go to one of these healing centers and just go grab whatever product the facilitator recommends and go from there. And these facilitators, not doctors, not scientists, not nurses, these facilitators are laymen who will be certified through some unknown process at the state level. But that's certainly not how medicine typically works. So I think that's the big concern that I have, because that's the entrepreneurial route. Then we have the FDA route, where we have a neutral body of scientists who are going to put this through clinical trials. We're going to really know what we should take and how much we should take. And so I think the public loses when we rush with medicine, because then people could get hurt. Patients who think they're getting helped could actually get harmed. And we win with the FDA because, yes, it takes a little bit longer, but that's what we've kind of understood over the last century is what we need for medicine, is to fully understand if these drugs work. So let's just do a really quick, Luigi, I won't waste a lot of time, but let's do a really quick history lesson on why we have the FDA. And, I shouldn't be the one having to do this. I'm a lot younger than maybe most of the folks are going to be voting on this thing, but let's just take a little walk through history. So Tuskegee Institute, where these companies experimented with syphilis and drugs that would purportedly help with syphilis on members of the Black community. And many of them died and they were harmed, and it was horrific, but there was no protocols. It was just companies turning their medications loose on these people. Now let's fast forward to just in recent memory here. Many of us heard about the story of Theranos, Elizabeth Holmes, who developed a novel way to test for blood. She got around a lot of the FDA regulations and protocols because of the way they did their product. It was a little needle that you could prick in people's finger. They raised $1 billion. Then it comes out she was lying about this product. It was not accurate. It was not giving patients accurate test results. And so many patients died because their cancer was misdiagnosed. There was no actual results for this company. Okay, that is what concerns me, because that's when companies are allowed to experiment with their medications directly on the public. That's the risk of what could happen, versus slowing things down, as we've learned in this country is needed, and letting the FDA do its work, put these products through thousands of patients and trials and really understand what happens with them, because that's how we can guarantee safety for patients. And so I frankly, my question, and I wish that they were here because it would be great for the discourse, for the Proposition 122 campaign would be, where is the line for our medications where the FDA still has control over what is medicine and where we just vote on these medicines? Because we've never voted on medicine before in this country until medical marijuana. Now these same people that brought us medical marijuana are bringing us medical psychedelics. And so my question is, where is the line there? Because, do we abolish the FDA? Have we decided that 100 years of regulation of medicine hasn't worked out? And so, we should turn this over to for-profit corporations because they're so trustworthy with patients' health? I mean, that's a question we need to think about. This measure, I think, is bigger than just voting on a few psychedelic drugs. Much bigger. I think this indicates a trajectory and a trend of voter-based medicine instead of science-based medicine. And my question is, Colorado, do we want our patients, do you want your loved ones getting science-based medicines, or do you want your loved ones getting medicine from somebody who calls it medicine, who has no idea what medicine is, an Elizabeth Holmes type who's going to prison right now because she hurt patients? I don't think we want that route.
So a couple questions there. When you say that we might see some of these, we might see the feds actually start allowing for prescriptions of psychedelic substances, and that they may happen soon. How soon is soon? And the follow-up question to that then is, there are people, if the science or some of the study turns out to be correct, and there's some validity to these claims, and therefore there are some people who can take advantage of this right now. What is at what point do we say, okay, we've got enough data, we've got enough studies here that we can go ahead and do that? We don't have to wait for the feds. What is that time frame then?
Well, I don't think there is a time frame. We have to wait for the feds, period, because that's how medicine works in this country, and that's how it's worked for the last century. I mean, we have never voted on our medicines before. I didn't vote on Advil. I didn't vote on ibuprofen or generic forms of these drugs. And we shouldn't begin to do that. Just 2 years ago, we voted on whether or not to allow wolves into our state of Colorado. And I will be willing to bet money on the fact that 1% of the voters probably had a clue which way to vote on that measure. And yet we were asked to vote on it. So, at some point, we have to let the experts make these decisions. And with medicines, I think we all agreed as a country over the last century, it was a good idea to let scientists lead our medicines. And so I think it's really important we make that distinction. As far as timeline, I don't know what the timeline would be. I'm assuming probably in the next year or two, because the FDA has advanced these through several clinical trial phases. Now they're in phase 3, which means once they finish that, they should be basically ready to go to the public. So I think we'll see these medications very soon. Even if, to your question about, and I think it's a fair question, if the research turns out great, then patients could take advantage of this now. But my question is, what if the research turns out not great for several different large subsets of the population, and those subsets start using these drugs because we state level legalize it in contradiction of federal law, and then those patients get harmed? That's, so it's what if it's great, but also what if it's not? And I think, there's this perception in the Proposition 122 campaign, and they're not here, so this really, we're being fair here because they had a chance. They would like us to think that these are just dietary supplements. Like this is just saying, oh, well, let's let people get access to ibuprofen on the streets because, that's not that big of a deal. But these are very strong psychotropic drugs that alter the mind. Ibogaine, for example, which I'm willing to bet that 1% of the people listening to this have ever even heard of Ibogaine, and yet I hadn't even heard of it, frankly, until I did the research on it when this measure came out. So we're all going to be asked to vote on this like medical experts, even though we've never heard of this before. But Ibogaine, that is a drug that Journal of Arrhythmia, Journal of the American Medical Association, all these major medical journals have identified the link between the use of that drug and cardiac arrest and death. So patients have been given that drug to help with these miracle concepts that are out there, and hopefully they'll prove true, but they have died from it. Even under supervision, they have died from cardiac arrest from the use of this drug. And that's just one of them. We have issues with persistent psychosis and hallucinogenic disorder with all of these drugs that we're talking about legalizing across our state. So, we really, this is not just kind of, legalizing some natural plants that aren't going to really impact people. These drugs are very strong. People will hallucinate, they trip. You look at what's going on in these studies, even the very promising studies, okay? These promising studies had 2 different therapists in the room with someone while they're tripping for 8 hours, very tightly controlled. You're telling me that these healing centers with one facilitator, they're going to have groups of people in there, a lot of tourists from out of state and out of the country, and they're using with them, that these are going to be tightly controlled like these studies were? I don't think so. And I think that's a recipe for a lot of health concerns. So it's really important to understand these are not just kind of natural plant medicines that, no big deal. These are very powerful mind-altering drugs that will give people, a lot of people have very bad experiences on trips on these drugs, and they still may be helpful, but they need a very, very applied scientific hand in the room, or 2 hands in the room to watch them and help them through that process.
There are 2 implicit assumptions in your answers. One is that you distrust an industry-driven or / voter-driven initiative on medication. That means you don't trust the companies, the businesses, if you will, to do the right thing. That's an implicit assumption there. And correct me if I'm wrong. The other implicit assumption, of course, is that the FDA process is the right process, the proven process. It is the process we should go through. It doesn't. The FDA obviously doesn't always get things right, but your assumption here is that we should trust that process, specifically on this one.
That's exactly correct. Very, very well done, Luigi. You've always been very bright. I've been very impressed by that. But yep, you nailed it on the head.
So what about the argument that, and again, go back on, the argument that Coloradans cannot wait for the feds to act, given, among other things, the state's low access to, for example, mental behavioral health services. And if these were available to them, we expand that access.
So you're saying, what do I think about that if it expands access?
Yes.
Yeah. So, I mean, it's not, so we have a mental health crisis nationally. We have a mental health crisis in our state. Okay, homelessness, mental illness, and drug use; those things are all kind of overlapping, and we don't have even remotely the budget, set aside for that, or the number of healthcare and mental health professionals to address it. So, looking to a measure like this to solve that problem is frankly laughable and really frightening if this is the best that we can come up with, because it's not a holistic response. It's, and it's so funny because historically we hear a lot of people complaining about, oh, just take this pill and it's going to solve your problems. And I think we all intuitively understand that that's kind of a total farce now. But we have the same thing happening again, where it's like, oh, well, these substances, they really could help us miraculously with mental illness. And so this is going to be the miracle solution. So let's just legalize it, let these industries do their thing and solve our mental health crisis. And that's just, there's just no reason, nothing in the evidence to suggest that that's what this is going to do. We're talking about, folks will be able to literally grow these things in their backyard. So people will be, first of all, we'll have no idea if they actually have a diagnosis for mental illness. So we don't even know if the majority of the population using these drugs will have any form of mental illness. This is going to be open to the public. There will be no gatekeeping. It'll be, you can go to a healing center and you can get these. And if you say you're sick or not, it's really not any of their problem. So we don't know if this is fully going to be addressing a mental illness population or not. But regardless, I can pretty much for sure tell you that if it came down to just using psilocybin to solve our mental health crisis, I think we would have done that a long time ago. And I will actually go further, and I'll tell you, we had medical marijuana that was supposed to solve PTSD. I was around, I voted in that election. We were the number one TV ad and with medical marijuana was a veteran saying it's going to solve his PTSD. Well, here we are 10 years later, or more than 10 years later, because we legalized medical marijuana earlier in the 2000s, more than 10 years later, and we have another veteran telling us that these drugs will solve his PTSD. Okay, so I'm getting, frankly, sick and tired of people using our veterans as a way to sell their latest products and miracle cures. I was raised, if it sounds too good to be true, it probably is. Medical marijuana didn't solve PTSD in Colorado. So I have a hunch that psychedelics are not going to solve PTSD either.
Now, you said that the argument is that this is the path to solving all of these behavioral and mental health challenges that we have. But is that the argument, that it is the solution, not a solution or one of the solutions?
That's a great point. The claims that I hear is that this will solve PTSD. That's one of the ads they're running right now on TV here in Colorado. The claim is that these will provide an answer to the mental health crisis, and they prop it up because, and this gets back to what you rightly noted, my suspicion of for-profit industries leading medicine, and here's why. Because these companies are for-profit companies. They're not nonprofit hospitals like most of the hospitals here in Colorado. They are for-profit. So their legal definition of responsibility and fiduciary duty is to their shareholders, not to the public well-being, not to the public health. That's not their duty. Their duty is to enrich their shareholders, which, great, this is capitalism. That's awesome. I started a digital healthcare technology startup and sold it. Capitalism's been good to me in healthcare. I have no problem with that. However, we decided that there's a dark side. We understand as a country that there's a dark side to medicine. And I gave those historical examples where companies will, in the pursuit of profit, in the blind pursuit of profit, will cut corners. That's why we need regulations. If we fully trusted companies to always do the right thing in this country, we would have no agencies, no regulatory authorities in this country. We would have no anything. And maybe there are some of us who would like to abolish those entities, but I think we all understand that there are going to be limitations to the good that these corporations will do because of their responsibility to profit, not to the public. Okay, so and so you look at the example like Elizabeth Holmes. Okay, she knowingly lied about the efficacy of her tests. Fake it till you make it works great when you have a digital marketing agency or startup or an app. Fake it till you make it, which is the way entrepreneurs work in this country, does not work well with medicine because patients get harmed. So, to your point, no, I don't trust these companies to do this. I don't trust that, without some sort of regulatory guidance, that it will be safe. And so I think what we've seen is, the FDA has not been perfect, but the FDA has helped us deliver a lot of medicines more safely. And I think we need to follow that example.
Let me shift just gears just really quickly. What about the argument that, putting people in the criminal justice system for using what the yes side describes as naturally occurring substances that have potential mental health benefits? doing that, incarcerating them, does not really benefit society. It's costly to taxpayers. I mean, I think for most folks can agree that incarceration is quite expensive. So what about that argument?
Yeah, so that's another issue that is not up for debate in this proposition, because this is not about decriminalizing the possession of these drugs, although that is included in this. But this is actually about commercialization. This is actually about creating an industry that can advertise. And if you don't believe me, read the text where it says legalizing distribution, advertising, production of these drugs. Okay, so it's in the text of this measure is the commercialization and licensing regime that they're trying to create for an industry that wants to make money. Okay, so that's what this is really about, not decriminalization. But to your point, though, these are drugs, interestingly, that are not as widely used, and I think we intuitively understand that because that we don't see the prevalence of these drugs everywhere in our state or certainly our country. So I think they looked at the numbers of who was in Denver. Because Denver voted on deprioritizing law enforcement around these drugs, which they passed. So in Denver, this isn't even a discussion. But they looked at the numbers, and it was like 2 digits, the number of people that were in prison or jail for the use of these drugs. Okay, so if anyone, it is a very, very small number of people in prison right now for this. Whether or not that should be the case, whether or not these drugs should be criminalized, that's not really the point of the debate today. But what I will say is there's a difference between commercializing and promoting these drugs, which is what this initiative does, and discouraging the use of these drugs. And how we discourage these drugs, I think there are many different policy ways to do this. So you could decriminalize it. You could say that you're not going to get a prison record. You're not going to go to jail for this, but you're going to get a little fine. And that's typically what we saw with decriminalization of possession of marijuana, for example. There are many ways, but I do think it is very important we continue to discourage the use of drugs in our state, because we have an alarming level of drug use across the board, whether it's fentanyl, whether it's marijuana, whether it's alcohol. Our drug use levels and addiction in this state have never been higher, especially coming out of COVID-19, where people were isolated. They were using these drugs to self-medicate. If we legalize these drugs, we're going to have a whole nother list of drugs on the menu for people who are seeking to get out from isolation and from other kinds of mental health distress. And I think that's very concerning. So I do think we should continue to discourage the use of more drugs in this state. We can't walk back marijuana, but we have the ability to make a decision if we want more drugs to be encouraged to be used in our state. And I think we should think about that.
Undergirding your opposition to Prop 122, fundamentally, one of the reasons is that you're opposed to drug use, broadly speaking, or at least your organization is. And your argument,
non-medical, non-medical. Yeah.
And your argument, or recreational drugs, if you will, and your argument is that allowing the use of recreational drugs, for example, is inherently not good for society. Flesh that out a bit for the audience.
Great question, because it's interesting. We hear a lot of discussion about crime in our state and in our country, and everyone's seeing the alarming rises in crime. Nobody's really talking about what the root cause, though, is of the crime. And it's really interesting. I sit on the Lone Tree Citizen Advisory Board for our chief of police in the city of Lone Tree here in Colorado. And asked the chief, I said, what's the #1 factor involved in these property and violent crimes and all other crimes going on across our city and in Park Meadows Mall, which is within our city as well? And he told me by far, no question, it's drug use. Drug use is the #1 factor involved in the crimes that they're dealing with. And you look at the state level and you look at what's being prosecuted, you look at the reasons for these property crimes, vehicle thefts, and other things going on. Almost all of it is related to fentanyl now and other kinds of drug use. So we've seen historically throughout more than 100 years in this country that drug use comes associated with a whole host of societal ills. People, when they're addicted, when their mind is altered, will make poor decisions. I don't think that's hard to understand. We are even understanding addiction even better now, that people will make very illogical decisions when they have the disease of addiction. They'll even use drugs that they know might be contaminated with fentanyl, knowing that could be their last dosage, that could literally kill them. But they're so addicted that their body literally forces them to take these drugs, even knowing that they could die after using them. So we know that drug use has a harmful impact on society. That's why, as a country, we have discouraged the use of drugs. We have passed laws against drugs. And it's really important that we continue to do that, because I think the message we send to our kids, if we decide, well, drug use is actually an individual liberty issue. We ignore the issues of driving. We ignore the issues of school bus drivers. We ignore the issues of teachers and people who are in positions of public trust. If we have a society that encourages and normalizes the use of drugs, you will have people that, they may not intend to do bad things, but their mind will be altered and they will make decisions that will harm other people. And we as a society, if we agree that that's the route to go, we will have to accept those negative externalities as coming with the cost of business. So, teachers that are impaired, school bus drivers that are impaired, airline pilots that are impaired, there's a whole lot of things we got to think about if we're going to allow this kind of use to propagate in society. And so I think we're getting a little taste of that in Colorado right now. You look at Denver, you look at the tent cities, you look at the homeless, you look at all these other issues. These are symptoms, not just of drug legalization, but certainly drug legalization plays into this. These are symptoms of what we've allowed. And so we have to think about how we can mitigate that. And I'm not arguing for a renewed war on drugs and let's throw everyone in prison. But we need to have a society that discourages the use of these drugs and the promotion of these drugs. And there's many ways we can do that.
Didn't want to necessarily get to this point, that now that you noted and now that you mentioned it, what about the argument that, look, so our society does regulate certain drugs, does regulate certain kinds of, not addiction per se, but our society has allowed certain kinds of drugs. I think number one, of course, on the list is alcohol. Our society has decided that alcohol use is fine. We have laws that would deal with, for example, if you committed a crime, let's say DUI is a result of driving under the influence. There are laws that deal with, the excesses, if you will, of using this drug. But so why? I guess the argument then, and you probably heard this a thousand times. Why are we allowing certain drugs to be, legally regulated and not others?
Great question. Yep, I've heard it a million times. Real quick before I answer that question, I will say Proposition 122, as it relates to driving, has no standard for impairment with these drugs on the road. So if somebody is tripping out and goes on the roads, we have no standard for impairment, no 0.08 limit like we have with alcohol. And also there's no roadside test. So there's no ability to regulate these drug issues on the road with Proposition 122. That is a major concern we should all be very, very wary of. Okay, so to answer your question though, I've heard this refrain before, but what about alcohol? But what about tobacco? These things are harmful and legal. And I liken that to, that's like saying, okay, well, the tail lights on my car are broken. So why don't I break the headlights too, just to be consistent? and obviously there's no logic to that scenario whatsoever. And so what do I mean by that? Well, what
you're saying, and correct me, I just want to make sure I'm understanding you correctly. And I think I do, but correct me if I'm wrong. What you're saying is that, look, you view alcohol use as inherently wrong. And
not wrong, not passing moral judgments today, but what I will say is, nobody thinks that we should have more people using alcohol, that the world would be better if more people used alcohol. I don't think anybody in the right mind thinks that. So I think we all understand that alcohol use is a vice. It's called vice, tobacco, a vice. Society understands the use of these drugs, particularly the heavy use of these drugs, is a bad idea. And let me just finish the thought here, Luigi. So alcohol use, alcohol kills 100,000 Americans every year. Alcohol is involved in 6% of the cancers in this world. Alcohol caused them. That's what the science is telling us today from the CDC and the World Health Organization. Tobacco kills more than 500,000 Americans a year today. More than 500,000 Americans. So I don't think anybody looks at these two drugs and says, wow, what a perfect example of regulation and everything's working great with these drugs. I mean, I went to public high school. These drugs flowed like water through my high school. I think we all went to high school and saw these drugs flow like water. So the idea that we're regulating them and kids are not getting access and, no one's getting harmed because we have laws to deal with them, that's not happening. What we're seeing is massive. I mean, let's just talk about alcohol for a second in Colorado. It has never been easier to get alcohol in this state than it is today. And it's about to get a lot easier if people pass these different ballot. I'm not going to talk about the other ballot measures, but there's other ballot measures to get alcohol even more out there. Okay. And so you can get it delivered. You can order it online. You can go pick it up at a window. Alcohol is so freely available. And we have literally are coming out of COVID-19 where alcohol addiction has never been worse in this state. I mean, the amount of consumption has never been worse. And the industry is allowed to flourish and make it more accessible. And not only that, the taxes on alcohol have never been, they are lower than pre-Korean War levels, the taxes on alcohol are, okay? So it's just really wild that the industry has been allowed to make a ton of money with very, they've worn down the regulations. Tobacco has been allowed to make a ton of money. They're still killing a lot of people. So why? Why, Luke, why are these drugs legal? Because that was your question, Luigi. Why are these drugs legal and these other drugs not? Well, historically speaking, these drugs were embedded, particularly in Western civilization. So, 60% of the country uses alcohol. You're not going to lock these people away. You're not going to eliminate that demand. You had a situation where now it's a lot lower, but a large number of Americans still smoke cigarettes. You're not going to throw all them in prison and those kinds of things. So these drugs have societal acceptance that is historic. And when I say historic, I mean over the last several thousand years. Okay, these other drugs not used at those kinds of levels, particularly psychedelics. I mean, marijuana was the #1 most used illicit drug in the country. Okay, so a little bit different of an example of marijuana. But you look at psychedelics, very small number of people are using these drugs. When you allow an industry to sell and produce and advertise these drugs, their interest will be to get more people to use them because they're a for-profit company selling a product. I had a digital health startup. I wanted more doctors to use my product. Okay, so that's the whole point. And so this industry will then try to ramp up the use of these drugs. And so the question here is not, oh, psychedelics are worse than or not worse than these other drugs that are legal. The question is, we have issues we all understand with alcohol and tobacco. There are externalities there. There are hundreds of thousands of people losing their lives from these drugs. We've accepted that because it's a cultural, they're culturally ingrained. These new sets of drugs are not culturally ingrained. Do we want them to be promoted and normalized in our society on top of the issues that we already have? Do we want more issues? And so that's why I give that example of, well, my taillights are broken, but now I'm gonna, bash in my headlights too, because it's a question of, do I want more problems? Do I want more issues or not? And just from a liberty perspective, the amount of regulation that it requires just to deal with alcohol and tobacco, the amount of regulation is going to require to now try to regulate these psychedelics and then possibly future drugs. That's going to create quite a large government. That's going to create quite a large regulatory regime, and it's going to create quite a large health regime as well, because we will have to deal with the negative health externalities of the use of these drugs as well. And so those are things we have to think about too.
Now, you mentioned that you don't necessarily view alcohol use as wrong, because when you use the word wrong, that we're completely in the moral landscape here, right? Yeah. We're completely in whether you agree.
Well, I think whatever you think about it, it's irrelevant to the discussion. I think, I think the issue with alcohol is we have to understand the facts and the data around it. And I know that 100,000 or more Americans die every year from alcohol. And so I know that there are
arguing. I guess my question is, you are arguing from a moral perspective. You are.
Well, so what I'm arguing from is, you could take it from a moral perspective, but what I'm arguing from is a science and fact-based perspective of, we know that when we legalize and commercialize alcohol, these are the externalities that come with it. More drunk driving, more promotion of alcohol products, more underage use of alcohol. We know that comes with that. That's just a fact of, we all see that in society. We know that with legalization regulation of tobacco and the allowance of tobacco industry, that 500,000 Americans will die from that kids will get into that there's addiction. There's a whole class of people addicted to cigarette products. We know that those are externalities that come with that. So what I'm saying is, there will be externalities that come with the legalization and commercialization of additional drugs, whether it's psychedelics or other things. We see that in the literature. We see the issues with cardiac arrest and death from ibogaine. We see the issues with persistent hallucinogenic disorder from the frequent use of psilocybin. We see these health externalities with the use of these drugs. So my point is, from a fact and data perspective, we know there will be harms that come with this.
There's
so
a cost of society.
Yeah. So we as a society have to decide, is that what we want? We have to count the cost. Is that a cost we want on the ledger?
You mentioned, liberty and freedom. So let's talk about that. There's always an assumption that adults will know what's best for them. And, if they take alcohol, for example, they've decided to take the risk. And the risk comes not just from health problems, addiction, but also going out drunk and then going to jail as a result. Losing your license, losing your job, losing a whole lot of things, all of these troubles that we see with alcohol addiction, for example. And you can extend that to the other drugs that we have allowed as a society to be legalized. Why not give why not extend that argument, that logic, if you will, to psychedelic mushrooms? Let people decide for themselves. They're adults. They would know what to do. Why shouldn't they be free to just do what they wish to do in the same manner that they're able to do with alcohol or tobacco right now?
Yeah, I think that's a great point. And I think if you're somebody who thinks that this is a liberty issue, I don't think this proposition is for you, because this proposition creates an industry promotion. It creates products that are going to be advertised that will impact kids, that will impact society. If you see this as a liberty issue, I think you have to say, well, maybe we should decriminalize the possession, or maybe even the growing of these products, but have it stop there, because that's really where it would stay, supposedly individual. But what we know from drugs is that they are not victimless crimes. Okay, the use of drugs is not a victimless crime. There are many victims involved. If you're a parent and you have little kids, and I have 2 little girls, you can see over my shoulder, so I'm thinking about them every day and what I do for our state. But if you're a parent and you're tripping on psilocybin, for example, can you be a good parent? Can you be the responsible parent when you're on a trip? Is that possible? That's a question we need to ask. If you are driving, if you're responsible for a large number of people and you're using drugs, those are the questions we need to think about, the societal impact. And so I think when you look at John Locke, okay, godfather of our liberties, if you will, John Locke said you had the right to life, liberty, and property. Most of us Americans, we hear life, liberty, and the pursuit of happiness. That's what our founding forefathers put in our documents. But Locke came up with life, liberty, and property. And so the idea was government could make sure that those things are protected for each individual. So if you're a libertarian, you're somebody that really is extreme on our liberties, you want your life, liberty, and property to be protected. Your life and liberty and property are not protected if folks are using drugs and choosing to drive your kids off the road and they're a school bus driver, or if you are working at a factory and somebody tests positive for that drug and goes to work anyway and is impaired and has an accident and hurts you or even kills you. Your life, liberty, and property are not protected in those situations. So from a liberty perspective, we have to think beyond the use aspect, because of course we all make this decision ourselves individually to use the drug. And what happens after you use the drug? If we lived in a libertarian society, which we're getting philosophical here, Luigi, but there's never been a libertarian government that's been successful in the world historically. So I'm open to looking at the example if there was one in the future, but there's not. We live in a society where there are there is a safety net, there's welfare, there's all these different lines of association. So if we lived in a vacuum, maybe we could have that conversation about the individual liberties of drug use, but we don't live in a vacuum. We live in a society where taxpayers foot the bill for emergency services. So when somebody's having a bad trip and they need to go to the hospital, we're paying for that as taxpayers. If that person has no insurance, we are paying for their entire stay of care at the hospital. If that person has Medicaid or Medicare, we are paying for their entire stay at the hospital. So we need to just be realistic about the ways in which community exists. And so this idea of liberty needs to be teased out a little bit further. The choice to use drugs, it's very infrequent that it only impacts the person who uses them. Usually there are many other people impacted as well. And you need look no further than somebody who grew up in the house with a father or a mother who is an alcoholic. They'll tell you that it impacts more than just the person who's using it.
You mentioned that I can't remember this one really well, so don't take take this with a grain of salt. But I read somewhere that in Denver, for example, which is deprioritized, if you will, going after possession of psychedelic mushrooms, that the arrest was somewhere along the lines of 1% or something like that of all arrests. It's a very low number. Isn't that an argument for it? Meaning to say that there will be some people who will take advantage of this. If the voters said yes, there will be a small number of people, a very small number of people who will take advantage of this one. And presumably a good number of those small number of people who will take advantage of this would be people who would benefit from it, either from they might have some mental behavioral challenges that presumably this would help him. So it's a minutia, it's a small number of people in the grand scheme of things. And therefore, the argument is why not allow it for what we already know would be a small number of people who would take advantage of this.
Yeah, a great question. Well, what I would say is that no for-profit industry, which is what this would be content with keeping it at a small number of people. Okay, so when we legalized our medical marijuana program in Colorado, it was supposed to be targeted for a very small number of people who really, really need medications, cancer patients and things like that. But we quickly saw the number of people using medical marijuana to go into the hundreds of thousands, many, many more people than we ever anticipated. And then, of course, it went to recreational. So an industry forms to make a profit. It does not form to serve the need as it is and keep it there. They want to grow their market. So they're going to try to find ways to get more people to use these drugs. And that's the point, this is about commercialization of these drugs. It is not about decriminalization, and it is not about just making medicines available only to certain patients. This is available to the public. And by the way, if you're a city, town, or county, you are banned from opting out of these centers in your locality under this initiative. So like with, in marijuana, we were all able to opt out. With this, we are not able to opt out. So the idea is it is forced into your front doorstep. It is forced into your communities because they want to introduce you to this idea of using these drugs. And I'm not saying this because it's some insidious thing and I think these people are evil. I'm saying this because it's a for-profit company. And the goal of a for-profit company is to expand the market, grow the market, and grow their resources. That is the way that it works. And great, great, great thing when it's helpful products and services. Not a great thing when it's drugs that can be misused, that can be harmful, that could have health effects. And so I think that's the point. So to your point, Luigi, you may say it's a small number of people right now. It probably won't stay that way if we allow this to be promoted the way that this initiative allows it to be promoted.
I want to spend just a couple of minutes on your other work, if you will, which is your other organization that opposes recreational marijuana or legalization of marijuana in other states. So what is the landscape nationally? What is it looking like?
Yeah, so we need to, so I mentioned earlier, for those of you who missed this, that the same funders and same campaign team involved in legalizing recreational marijuana are the ones quarterbacking this measure to legalize psychedelics. So it's not a crazy logical leap to say, let's look at the example of marijuana and compare it to psychedelics, because this is following the exact same playbook. Start with medical marijuana, go to recreational. We're looking at a medical psychedelics measure. I'll give it about 2 to 3 years before we go to recreational psychedelics. So, we need to look at these examples. And so what we saw with marijuana is we all here in Colorado thought we were voting on a joint that was just, Woodstock weed, 1 to 3% THC. That was the potency. Industry forms, and overnight we start seeing candies, concentrates. Dabbing of marijuana was invented. This never existed before. And so the concentration of this drug, marijuana, went from 1 to 3% on average to products that were over 90 to 99% potency THC. So the drug changed dramatically, became much more addictive. So what we know is that during the 90s, average user of marijuana, 1 in 10 who used in the last year would develop an addiction. Now what we see with today's new high potency marijuana is that 1 in 3 who used marijuana in the last year will develop an addiction. And that's according to the National Institutes of Health. You can see that on their website. That is freely accessible to everybody there. So that's what the research tells us. The addiction rates have skyrocketed. What we're also seeing is psychosis. So many of us, I think, have heard the story of Laura Stack and Johnny Stack. Laura Stack is my neighbor. She lives here in Colorado. Her son, Johnny, had a perfect SAT score, no history of mental illness, no issues whatsoever. He was 16 years old. He obtained a legal medical marijuana card, got high potency marijuana, started dabbing it legally under our medical marijuana laws, went psychotic and fell to his death. He jumped to his death from the parking garage of the Lincoln RTD stop, not far from where I live. Okay, so that's what happened to Johnny. No history of mental illness, no issues. Okay, so clearly we've seen an increase in the mental health adverse impacts of the use of high potency THC. So bad that we passed a bill last year or year before last in our legislature to research high potency marijuana. So bad that even the Denver Post, which, guys, I'm glad you run my op-ed pieces. The Denver Post doesn't want to hear from me, but the Denver Post editorial board even wrote an editorial formally asking for a cap on potency of marijuana because of how bad it's changed. Okay, so what we saw with the commercialization of marijuana was new forms of marijuana, more highly potent, more mental health issues, and more addiction. Okay, and this was brand new. We didn't have this issue with marijuana 20 years ago. It happened, it coincided with the creation of an industry. Okay, so Walk with me from that parallel over to what we're being asked to do with psychedelics. Create an industry. We don't know what kind of formulations and how they'll do this product. We know that the definitions of these drugs, it's not just plant-based. They can be synthetic forms. They can be, it's legalizing, quote, all forms of these 5 different psychedelic substances. So once again, we're being asked to vote on something that we have no idea how it's going to turn out. We voted on marijuana. We had no idea what dabbing was because dabbing didn't exist. We had no idea what THC concentrates were because those didn't exist. We had no idea what this industry would come up with. We're being asked again to vote on Pandora's box with drugs, with psychedelics, where this industry is going to be asked to promote them, to produce them, create them. We're asked to vote to allow them. And we have no idea what's on the other side of Pandora's box. And so I do think it's very important we understand that this industry is the marijuana industry is $40+ billion. I just saw an advertisement for the first psychedelics business forum that's happening. It's a national business forum for psychedelics, and psychedelics are illegal in all 50 states. So, I think it's really kind of crazy. I see a question here. What is dabbing? So dabbing high potency marijuana is when you get a very small amount of highly concentrated THC, usually 99% THC. It vaporizes, you heat it, it vaporizes, and then they have a dab rig. They take it up and they get very, very high very, very quickly. If you YouTube dabbing, you will see some very young people dabbing marijuana, blacking, browning out. It's really unfortunate, really not fun to watch, but you can see what that looks like on YouTube, unfortunately. But that's what we saw. And again, that didn't exist. And let's just go back even further really quick, Luigi, humor me. Let's go back even further, about 100 years. Tobacco, okay? We have used tobacco in our society, Western civilization, for thousands of years. Nobody was dying of cancer from the use of tobacco pipes and all these things over the last thousands of years. What changed 100 years ago? We had the invention of a big commercial tobacco industry, the invention of the cigarette, and the global supply chain model of selling that cigarette everywhere. They changed tobacco, they added nicotine, they put in ammonias and other additives. They made this tobacco drug more addictive and more harmful than it's ever been. And now it's one of the leading causes of cancer in the entire world. Okay, so that's what changed. Commercialization, historically, is what changed tobacco to become a global killer. Commercialization is what changed marijuana to become addictive, to cause all these psychoses and other mental illness. Commercialization is the key issue here. So we're now once again being asked to commercialize psychedelics in our state, and looking historically, I have a lot of reason to be concerned about that.
Since you mentioned another newspaper, I just want to reiterate to our viewers and our listeners, do subscribe to the Denver Gazette.
Yeah, Denver Gazette.
Colorado Politics and the Colorado Springs Gazette. I know Vince will appreciate that. I think we have room for a couple of questions here. One question I got is that psychedelic mushrooms has been in use in human history for thousands of years. You mentioned alcohol and tobacco use, of course. So this is a product that's not really new to us. It's something that we've known. It's something that us as human beings have used before. What about that argument?
Yeah, so I mean, you could say that about anything that exists in the state of nature. I mean, that we have these plants and other things that have grown, and our scientists have found the established harms of the use of these things recreationally, which is why they're federally illegal. Schedule 1 substances, all 5 of these substances are Schedule 1, which means no demonstrated medical benefit yet. That's probably going to change. And a high potential for abuse. Those are the 2 reasons why they're Schedule 1. So we know enough about these drugs to know that they should be illegal as far as just the general public using them. That's likely to change because the FDA has marked these as breakthrough therapies, as we talked about. So very soon we'll likely have medications for these drugs, but highly unlikely that these drugs will ever be federally legal to be widely available across the state, which is exactly what Proposition 122 is asking us to do, is allow these facilities to be in every corner of the state and allow anybody who wants them to get access to them.
Another question is there an educational campaign on these substances for voters? Let me modify that a little bit, because obviously the yes side is not here, but talk just really briefly about the educational campaign by the state, by other organizations on substance abuse, use of drugs.
Yeah, so I mean, the state government and cities are doing education on substance use and abuse statewide on all the different range of substances. Not seeing a lot on psychedelics right now because it's a political subject because people are voting on it. So Obviously, the proponents who have raised $4 million but can't raise enough courage to get on a panel with me here with you all. They are putting their TV ads out there. We are doing a campaign to try to enlighten people to the American Psychiatric Association's position, which is that there's no scientific evidence to justify the medical use of these drugs, period. That was from just a few months ago. We talked about that earlier, just to make sure everybody remembers this. So our campaign is focusing on the American Psychiatric Association. We're doing videos and other kinds of ads to get that message out. We've raised, I think, about 1/800th of the money of the pro side. But we feel like the facts and the evidence and the truth is on our side. So we're getting that message out every which way that we can. But we'll have to do a lot more educating. If this passes, we'll have to do a lot more educating on the state level to say, what these drugs are, what they do and don't do. And unfortunately, there will be a lot of patients and a lot of people who have to find out the hard way. And that's what I'm trying to prevent right now.
Again, this is probably a question that's best for the yes side, but what training will be implemented for first responders to handle overdoses and bad reactions to mushrooms? Care to
Yeah, these are all the different questions and complications that come with rushing to a decision like this to be the first state in the country to legalize these drugs. I don't have the answer to that question. There's certainly nothing in this initiative that would, indicate that they're going to take care of these problems for first responders. But that'd be a question to ask the pro campaign.
Could you directly speak toward the nexus that you pointed out earlier about allowing substances to be cultivated in Colorado homes and increase in crime?
Yeah, so it's a great question. Let's just look for the marijuana example. So we have a raging black market in Colorado for marijuana. I don't know how many of you know that, but the black market sells more marijuana than our legal market does in Colorado, which may shock you because we were promised to get rid of the cartels and the drug dealers, and no, their business has been gangbusters for them. When you have a situation where people are, first of all, let's talk about medicine for a second. We don't grow our medicine in our backyard. Okay? We do not grow, we don't grow hospital grade fentanyl in our backyard. Okay, we don't, grow opium poppies in our backyard and call that medicine. So it's really crazy that we're even having this conversation just from a science health perspective. Okay, but
look, just really quickly though, that is a very Western way of looking at things, right? Because in other parts of the world, they do grow their medicine. There are some herbs and what have you.
Herbal remedies, but not very strong mind-altering substances. So you're very right about that. Folks do that. And again, that's a really important, because the Proposition 122 campaign wants us to think these are dietary supplements like echinacea tea that, sure, grow echinacea in your backyard, or, grow ginseng, or ginger. But this idea that these mind-altering substances, which are very strong, that very much alter your mind, it's a totally different class of medications. But it's a fair point, Luigi, as far as that class of substances would go. But anyway, to the point about growing in your backyard and crime, I just saw a bust a few weeks ago. Aurora PD did a huge bust of illegal psychedelic mushrooms. There was literally, dozens of pounds of it. Cartels were distributing it and dealers were selling it. So I think the idea that people are going to grow this in their backyard, that's going to certainly fan the flames of people who are growing this and selling it on the black market illegally. I think we'll see all of that grow a lot more. Right now, the demand is very low. There's not that many people that use these substances. But as the industry builds that appetite, I think we'll see a larger demand for that in the black market.
Well, I guess we have room for just one quick question. Can these substances lead, in some cases, to mental illness over time? Do you know that for sure?
Absolutely. Yes, that is fully established in the literature. So there's two issues. Okay, so the first one is persistent psychosis. All 5 of these psychedelic drugs we're voting on, the use of these drugs is associated with what's called persistent psychosis. So literally, that's an alteration of your mental state where you're having a lot of us have heard of a psychotic break. You'll do very irrational things. You'll be panicking. You'll have a complete altered state of mind. That is and it's persistent. So it's not like you just have it because you're having a bad trip and then it goes away. For a lot of people, it'll actually continue. Okay, so that's why unmedical use, non-medical, non-regulated, non-observed use of these drugs is very dangerous. Second issue is persistent hallucinogenic disorder. Okay, so what that means is people will use these substances and then weeks and months afterwards, completely sober, maybe they didn't even use it once after that, they will have what's called persistent hallucinations. So they'll have those hallucinations again randomly without even having used the drug. And we don't know exactly why that is, but that is fully documented in the literature. So there are two issues here that, again, we need to be concerned about. That doesn't mean that they're not medical. The FDA has indicated there's a great medical promise, but what it means is this idea of an industry advertising these things and the general public just getting access to them. That's a little frightening. We have a lot of issues with psychosis in our state right now from high potency marijuana. That's documented in all the literature and in every major publication across our state.
I think we are out of time. I think this is probably a good time to end this. Luke, any last words, John?
My last words would just be, we should listen to the scientists, the American Psychiatric Association, the FDA. We need to follow our scientific process. We will get regulated access to these medicines. We should let that process go its course. We shouldn't put people in harm's way by allowing entrepreneurs to take mind-altering substances, again, a new set of mind-altering substances, and market them and promote them to the people. We have a bad track record when it comes to entrepreneurs taking medicines and shotgunning them. We should follow science. We should follow the evidence, and we should put the public safety first. And I hope you'll take a look at our website, protectingcoloradokids.com, where you can learn more about this. Check out my website on the Denver Gazette, and all the Gazette papers, my op-ed on there, talking about these issues and some of the literature behind it. And hopefully you'll get educated and vote no on Proposition 122. Thank you all so very much. And thank you, Luigi and Vince, for the time today.
Luke, thank you again for your time. To our viewers and listeners, thank you. And if you missed this show, your friends did, your colleagues did, we will be posting this on our websites at some point. And with that, I will say thank you again and enjoy the rest of your day.
Thanks, you guys.